Welcome, Dr. James.
First, I wanted to thank you. You're one of the only communities that's actually gone forward and actually got data. The coal dust study that was done is a remarkable document in many ways. In some ways reassuring, in some ways raising very serious questions. I think the fact that the near rail rates of coal dust exposure being so dramatically high is a very concerning thing and not unexpected. I myself became interested in this about 2 years ago when a much larger facility was planned for the community I live in, one where 48 million tons was proposed to be exported. Because of that, about a dozen doctors got together, and most of us were MDs, and many of them in that group were PhDs as well. And so we did what doctors would do. We went to the library. Not really the typical activists that you might see elsewhere. We asked Bea, the librarian, to shake down all the articles on coal transportation and storage. And she came up, surprisingly, I think, with about 400 articles. We worked through those articles, typically between 9 at night and 2 in the morning when we were home from our practices. And we didn't really get together a lot. We mostly did that on our own, and then would email each other the results of those summaries. And initially there was some vague concerns, but as we moved forward, those concerns became quite focused and honestly somewhat alarming. As we looked into it, what we found was that coal dust was one thing, but diesel particulate matter, the frequency of trains and blocking important areas for emergency vehicles, for ambulances, for fire, for police, and the safety with running more and more trains. As you know, in White Rock earlier this year, a woman was killed in our community a couple of years ago. A woman was killed. And in fact, those are not infrequent events as you look at it. These trains, if they lock up all the brakes, one of the coal trains is much heavier than a regular train. They take about a mile to stop. So that even if they see something in the track, it's virtually impossible for them to stop for it. So I pulled together some information. The committee here asked me to look to see if I could make this work properly. As you know, it's planned for down here, not far from where you're at, and it also goes all the way to Taxada Island in terms of there's a rail component and there's also a sea component. But the picture is actually much broader than that. It starts in Wyoming and goes up into Montana and Idaho, and then up through all the urban part of Washington, where they would bring the coal by rail. And finally, it actually would be exported all the way to mainly to China, but also to India and Korea. And there are many health impacts beyond what we're properly concerned about in our communities, or you might be in your community. But there are important cumulative effects. It's not just about this particular proposal of registry docks. In fact, there's increasing amounts of coal. There's probably about 128 million tons of excess capacity from the United States because we're not burning coal anymore because the health impacts are too great on the communities where they burn the coal. And that creates an excess capacity. That excess capacity is planned to be exported from a place in Oregon and Washington, and then also 4 places in BC. So you can see it's not just the Port Metro proposal in Surrey, but it's actually all these other ports could also take considerable additional coal capacity, which means more trains and many more exposures. What we did in our review is we first looked at some review articles. And review articles are those scientific articles that summarize other articles. They don't really count in the scientific point of view because they're general. But we looked through these 2 reviews that are very recent, 2011, and we looked at what those reviews show. And what they showed was a great and concerning list of respiratory and cardiovascular problems, strokes and lung cancer, increased mortality in children. Those 2 large reviews done by the American Heart Association, American Lung Association, outlined a great number of medical conditions that could be made worse by the transportation storage of coal. And then we began to work through the individual articles, and I'll hurry through these. I know I don't have much time, but the New England Journal of Medicine is arguably the most prestigious medical journal in the world. We began to look at where we thought places were that had the highest standards. So these are not casual articles. These articles have been published in referee journals. That means that before they're published, people that might like it and might not like it look at it critically and pick them apart. So they have the highest intellectual integrity. And so we began to work through these, and we looked at, for example, the effects of the air pollution that can be generated on lung development in people from 10 to 18 years of age, and what it showed was that there was a decreased lung function in children. We looked at another article that looked at exposures for ischemic or thrombotic effects, which is to say the things that cause strokes and heart attacks, and we actually began to talk to experts in the field. There actually happened to be one at the university where I teach. And they now understand the molecular detail, exactly how these things occur, so that we know and understand that. It was surprising to me to find how much we knew. But suffice to say, we worked through a series of articles, and I'll just go through these very quickly, but probably the beginning of this was back in 1952 when there was a temperature inversion in London. And when that temperature inversion happened, there were about excess 4,000 deaths in London, and that doesn't escape anybody's attention. And people began to make a connection between pollutants that we breathe in and bad health outcomes. And there's a whole series of articles that have come since then. This is one that kind of corroborated when there are these temperature inversion type events, you get these large number of strokes and heart attacks. We went on to look at articles about the development, showing that adolescents had decreased pulmonary function when exposed, that decreased pulmonary function in young people at levels even below. One of the shocking things that happened, I think, to my physician colleagues is they said, well, here's the national standard for safety, and well below that standard, we see bad outcomes. How can that be? And it was new to me, too, you know, that those standards are political rather than scientific was kind of shocking, honestly, to my medical colleagues. And you guys are involved in politics, probably not so shocking to you. For us, it was like, how can you have a standard when you know there's an adverse effect? But we found that in a number of places as we went through them. Pulmonary inflammation, increased rates of asthma attacks, ER visits, hospitalizations, increased ER visits for kids, admissions for asthma. Suffice to say, we went through about 400 articles, and I'll just skip through these relatively quickly. There were many more. But these articles we piled up then by category. And when we found that air and water pollutants from coal dust and diesel exhaust were significant areas, those two main things, and then increased train traffic and rail and boat traffic, noise pollution, delay in rail crossings, and safety. One of the people came up with the idea that noise would adversely impact people. And honestly, I said, you know, that can't be. You know, people will not take us seriously if we do that. We can't talk about noise. But being academics, he came back with a stack of papers, and he said, no, Frank, boom, read these. And when I did, one of the things we found out, for example, if you wake up an elder 2 or 3 times a night, they have an increased risk of cardiac arrhythmias. If you expose children that are trying to study in schools to noises, they have cognitive impairment from that. If you keep awake a working class person that's working, say, in a factory, the incidence of injuries and accidents goes up. So something that I said just wouldn't be significant. It turned out when we looked at the scientific literature, in fact, it was. So those are the main things that we came to believe were significant issues. And the main organ systems they impact are respiratory, cardiovascular, and neurologic systems. The other things that we discovered was it depends on, and it's exactly what your data showed here. If you're far enough away, it's not so bad. If you live near, it can be worse. And that's where the coal dust is the thing that goes the least far. The diesel particulate matter from increased train traffic goes quite a bit further. So the proximity makes a big difference. These trains, and in your case, the barges and ships, will go through some relatively dense populations of people. And when they do that, they will expose them to emissions, to vibrations, to noise that can cause significant problems. The other thing we discovered in looking at the data was that not everybody's affected the same. When the proponents for the one in our community came first forward, they wanted to average the pollution over our entire county. And you don't know what Whatcom County looks like, but it's a very long, thin county, 2/3 of which is wilderness area over the Cascade Mountains. And they wanted to average it over the entire area and say, that's your number. Well, what we found out was that people that live even on which side of the tracks and which way the wind blows is going to make a significant difference in whether or not people are impacted. So that if, you know, our predominant wind coming out of the south, if you live on that side of the tracks or that side of where the boats go, you're going to be much more significantly adversely impacted than people who live on the other side. And so, as you can't average it over the whole community. You need to see what's going to affect real people in real places. We began then to look for, well, what tools are there to assess these things? How do we take this information, it's pretty abstract in general, and apply it to a particular population? And there's an accepted way of doing that. It's called the Health Impact Assessment. There are international standards that have been cooperatively agreed to primarily by Canadians and Americans both. And those, what they do is they take this kind of information and apply it to a specific population of people. They say, where's the population density? Where are these things occurring? And what will the impacts be, and on what populations? How will elders be affected? How will children be affected? And so that's what we came to believe is an essential next step. That is what the people in Washington did not want to do. And so we did something that you haven't had to do, but we ended up generating 120,000 comments in the assessment period, unprecedented in our country. We had 9,000 people show up at hearings, and we demanded that a health impact assessment be included, and we got it. There was a scoping process where everybody gets to say what they think needs to be included, and those things were heard, and that will be included in our process there. I gotta say that I was shocked, because I think of Canada, I applied to immigrate to Canada a few years ago, and I still plan on doing it someday, and I think of Canada as the best nation on the earth. And I gotta say, it knocked the wind out of me when I found out what protections you have. Modest would be an understatement. You have no Clean Air Act, you have no Clean Water Act. In the U.S., if somebody's doing something of interest, we can sue them as an individual. You don't have that ability. We have port commissioners in my town. If those port commissioners are doing things that the community doesn't approve of, we can recall them. We can elect different port commissioners. I was very surprised to find out the airport is run by the people that use it. There is no local oversight. There is no provincial oversight. Now, you know this very well, I'm sure. But for me, it was just like, how can that be that the people that are most greatly impacted by this have literally no say? And then the actions that have taken place. You'll see tomorrow's newspaper. Something's going to be coming out in it, the Vancouver Sun, that I encourage you to read, because it is a review of exactly what's happened. 2 years ago, when we first started working on this in physicians, we made a commitment to each other. We said, we don't want to just push this out of our community and into another community. You know, we're organized, we're relatively well off, we can stop this in our community. And the first talk I gave about this was in Bellingham, Montana, a very long way away, plane ride away. And for the past 2 months, I've given a dozen or more talks here in Canada, because we are committed to not just shoving this out of our community into some other community. Well, 2 years ago, we sent the information we've developed to the provincial health officer and the jurisdictional health officers here in BC. And starting 2 years ago, they have asked that the court include a health impact assessment in the process. And again, you'll see in tomorrow's paper what the court said. It was sort of you can summarize it in a rude gesture I can't make in our setting. But they basically said it's none of your business. That we will be the arbiters of what health issues will or won't be looked at. So these regulators, your court, in terms of regulating this proposed activity, have been extraordinarily self-interested and extraordinarily kind of cavalier in their approach. It honestly is quite shocking. And again, those things will be coming out. There's been an effort to try to resolve those issues amicably between your health officers. And these are smart people. You guys got people with MDs and PhDs on your team that are very smart and very effective. And they've just basically been shown the door. And unfortunately, it looks like unless citizens stand up and demand it, there isn't going to be the kind of, I mean, in the States, we have a 2-year process of developing the environmental impact statement. 2 years. And that's after about a year-long scoping process where everybody gets to say what should be included or not. The court here said, we're going to do that same thing in 2 weeks. And when people said, they said, well, we've been working on it for a number of months already. But it is, I've got to say, ludicrous is not too strong a word, for how I see it, at least. And I'm an outsider, and Americans tend to be more strident than Canadians, are much more civil than we are. But it's just shocking. So Different people are affected differently. Children are affected differently. Elderly people, people pre-existing both lung and heart conditions, diabetics. For some reason, women over 50 came up repeatedly as an increased risk for a variety of these impacts. And workers are, of course, probably the most significantly exposed, and the closest to things. Children, a friend of mine, a neurotoxicologist, Steve Gilbert, made this statement, and I have to repeat it because I'm guilty of forgetting. They're not just short adults. They eat more, they breathe more, they drink more per body weight than adults do, and the impacts will be greater than it will be on adults. Now, just to briefly review, coal dust is known to cause chronic bronchitis, emphysema, pulmonary fibrosis, and has some very nasty things in it in terms of environmental contaminants. Not too long ago, approximately 500 pounds of coal would come off per mile. Per trip, per car, 500 pounds. And that's a lot of coal. And since then, they put surfactants on it, which they proposed to do here, a couple of surfactants, but that doesn't eliminate. That cuts it down to about 15%. But 15% of 500 pounds is still a lot, particularly when that substance contains lead and mercury and cadmium and other heavy metals. It is quite a serious, I think, exposure environmentally. You can breathe it in, you can cause problems, but it also is putting all those things into the environment. For the foodstuffs that are grown nearby, for the water supply, which then gets used in a variety of other ways. To me, it seems like you have to address that. This is roughly how much it was with no surfactant. It goes down to about this much. That's a 5-foot-tall man. So it's still about 1,200 pounds over the entire distance. Now, even more serious, I think, is the diesel particulate matter, both in the ships and the locomotives. This is the stuff that comes out on the top of the stack, and it's known to cause impaired pulmonary development in adolescence, increased all-cause mortality, measurable pulmonary inflammation, increased severity and frequency of asthma attacks, ER visits, and hospital admissions, increased rates of heart attacks in adults, and increased risk of cancer. That's not an inconsequential list. These particulates, when you burn them, there's a carbon core that comes out from the burning, and the organic compounds, sulfates and nitrates, metals and toxins, adsorb to that. And the thing about it is that's a 2.5 micron size. And I have trouble knowing what 2.5 microns is. Well, what I can tell you is that 10 microns will get filtered out up here in your upper airway, and you can cough it out. In the mucus, and the cilia bring it up, and you cough it out. 2.5 microns goes all the way down into the deepest reaches of your lung to your alveoli and come in contact with your capillaries and take those toxins directly into your bloodstream. And this is where the science is being worked out by researchers at the University of Washington and other places, where they show that those substances then go directly into your bloodstream. And in fact, they now understand the mechanism of why that then causes the plaques which form in everybody's arteries to dislodge and cause the heart attacks and strokes subsequently. Noise exposure, as I said, this is known to cause cardiovascular disease, including increased blood pressure and arrhythmias, strokes, ischemic heart disease, cognitive impairment in children, sleep disturbance with fatigue and hypertension and arrhythmias, increased rates of accident injuries, and exacerbations of mental health disorders such as depression, anxiety. Noise exposure in elders, definitely a problem. Noise exposure in children, definitely a problem. In fact, Regulatory Docs, this is not exactly your neighborhood, but every one of these gray spots, those are schools. This is the rail line, that's the dock. In the US, you couldn't put that. You couldn't locate a school. You couldn't build any of those schools because it would be against the law. Because it's too close to sources of known pollution that are significant. It's less of a problem here, but the big problem for us was delays in emergency medical service and police and fire. Clearly, in White Rock, this is a big issue. It may be an issue here too. Millions of dollars been spent by the province in trying to prevent that by having at-grade separation, that is the train and the streets separated. But there still are a number of places where this still could be a problem. It only takes, what does it take to have a heart attack? In the hospital, if we shave 45 seconds off response time between when somebody gets to the door and when they get on pump or when they get their thrombolytic for their stroke, 45 seconds is a big time. Typically, this will be an 8 to 10 minute delay It can certainly be a lot longer than that. Those kind of delays are the difference between living, literally, and dying. So what we believe is necessary is a health impact assessment. We believe that every community should ask for that. You should get this literature that we've developed, but it's there for anybody to look at, and then apply it to the community that you live in. And we believe that's a responsibility, that the court should take on that responsibility, that regulatory docs should happily take that on. They should not just do a 2-week whitewashing of the product in the project. It really needs to be looked at carefully to see exactly how many people it is. Sometimes I believe that the proponents of this want to talk about jobs versus the environment. They want to talk about that as a dichotomy. And I know that they've done focus groups to see that if they do that, they win. What I can tell you is the discussion I want to have is how much is it worth to a community to have one elder die, let alone 100? How much is it worth to have your child not have asthma? What's the relative value then? That's the honest discussion. Jobs are great. We need jobs. But the question is at what cost? There are many other issues about the environment. I'll touch on only one of them. There are many. The one that's most significant is that in the water that I drink every day in Lake Whatcom, that's our water source, people that catch fish there can eat them, but if they have a wife, a childbearing age, or a child, they shouldn't feed it. And the reason is because of the mercury content in those fish. And because you can now speciate things, science is wonderful, you can actually tell where things come from. They've actually speciated where the mercury in Lake Whatcom comes from. And it comes from a variety of sources. But between 15 to 30% of that mercury comes from China. It comes from the coal-fired power plants in China. So even though we're shipping it to China, we think it's their problem. They have plenty of problems from it, let me tell you. There's a recent article in the New York Times that said an 8-year-old girl has developed lung cancer in China, documented. 8 years old. You know, if we have pollution levels of per cubic meter, clean air is about 20 particles per cubic meter. In the US and Canada, if it gets to 100, people with asthma are supposed to go inside and lay down, you know? China's routinely 300. Recently, in the past few years, in the urban East Coast cities of China, it's 700 to 900, which honestly is incompatible with life. Yeah, that doesn't, over the long term, that doesn't work. So you can, but not even worrying about them. That goes up in the atmosphere, and prevailing winds bring it back, and that deposition of mercury ends up in our water supply. So that, again, I'm trying to focus just on the immediate health impacts to people in this community. There are lots of other issues that people can and should discuss. I'd be happy to answer any questions if you have them.
I'll ask one first. What is the status in the U.S. now? Like you showed us the long circuitous rail line. Where are you at on your side of the border with that?
Well, Americans like to ship American products, so there are plans to ship 120 million tons out of the States in 6 different terminals. 3 of those have died, are not going to be built. I think the 18th is the final hearing day for scoping for the Millennium, the 44 million ton down at Longview. So that's just at the scoping level. Ours, the scoping is finished, and they're starting on that 2-year process of the environmental impact statement. Interestingly, the proponents have not paid 1 penny for the environmental impact statement. They've had almost a year now to put up the money for it, and haven't put up a penny. I keep going back because I want to see what the scope of the health impact assessment is going to be, to see what's the details going to be. And that can't be done until they pay for it. So currently, there are 2 active proposals that remain of size. One's 44 million tons, one's 48 million tons. And they're in the process of being reviewed in terms of environmental effects.
But that's for the terminals.
Yeah.
What about the actual route and the
Those
shipping
routes,
of the coal?
and you'll find this is true in Canada too. There's absolutely no opportunity you have to say anything about them.
Yeah.
Because
That's why I wanted to know.
They're existing. As long as they have capacity, they can run them. You're actually better off than us in that respect, because there's actually a federal law from 1854. And what it says is that if there's an at-grade improvement that's required to make it safer or make it quieter or whatever, that can be done. But the local community is required to pay 95% of the cost, and by federal law, the railroad can only pay 5%. One overpass in Bellingham that they're planning on doing is $60 million. We will pay for it. there are 13 overpasses that would need to be fixed in town. So in that way, we're behind you. I think you have better laws than we do in terms of that grade improvements. In terms of the actual rail infrastructure, once it's there, you have absolutely no control over it. And I think that's just as bad in Canada as it is.
Mm-hmm. Questions?
Has anyone in the United States, to your knowledge, completed a health impact assessment for shipping?
For what?
For shipping coal?
No. There are about 150 health impact assessments that have been done in Canada and the US, and they have done them on a variety of things. On coal-fired power plants they've been done, on coal mines they've been done. There has not been one completed yet. There is one that is going to be required. Ours will be the first one. And in addition to the ones required, because there's some mistrust of the process, because it's paid for by the proponent and controlled by them. And when you look into it, we found some uncomfortable things. The first time, the person in charge of it, they gave you their name, and the first go at it, the person had a PhD in journalism. That was a bad sign. The current person...
You have to write the report.
But yeah, so they've actually changed vendors now, and there's another person in charge of it. She's a social scientist as well. And these people are expert at manipulating public opinion, to be perfectly blunt. And they're not the doctors and scientists that you'd like to see in charge of such a process. So, in addition to the official one, the people in our community have ponied up a fair amount of money to do one private. And we contracted with some people. There are three: the University of Washington, Washington State University, and the Public Health Institute in Oregon have agreed to carry it out for us. And so there will be a second one, in addition to the official one. There will be another one that hopefully will fill in the facts more objectively, perhaps, than the one that's funded by the proponent.
Is there anything more? Just the intent, would it be published in the journal as wherever the record is?
Well, elements of it could be. They certainly do get published in a variety of places. But it would actually be part of the regulatory process. So it would be published, but published as part of that regulatory process. There are studies like the coal study, the dust study you folks did here. There's a study like that ongoing right now on the rail line between Seattle and Bellingham. And that's set to be the first set of data to come out about that. And it shows, not surprisingly, that there's much more pollution than what had been assumed before. And that there's a second step of that that's going to be done over the next year or so. And will be included in that. So there will be these academic pieces in addition to the overall regulatory process.
So the two big terminals, Longview and Cherry Point, cannot go ahead without the health impact assessment?
Well, each has a separate regulatory process, and it's somewhat complex. There's county permits, state level permits, and federal permits that have to get to do it. And the one at Cherry Point, through the scoping process, has been required to have a health impact assessment. The one scheduled for Longview, its input period doesn't end until the 18th of this month. There has been the same level of input to that one as there was in the one in my community, and I'm hoping that they also require. The big players in ours was actually the state and our governor. Our governor said he wanted it, and the Department of Ecology is requiring it. In fact, they have a very progressive point of view. They're looking at cumulative impacts. That is, it's like here, do you look at that 8 million, or do you look at the whole cumulative? There's already a great deal of coal already going out there. And what you need to look at is not just that 8 million, you need to look at what the cumulative impact is going to be to see what the real impact is. So we do have that included in the one that's being done in Washington now for the Cherry Point facility.
So Longview may not have that.
Because it also requires state level permits, my guess is that it will, because they've already made that decision once. I think it was very difficult to be inconsistent in that respect. At the federal level, these are the people doing it where we're at are Goldman Sachs, Berkshire Hathaway. These are some of the wealthiest and most powerful investment banks and businesses in the world. And they actually have pretty good sway at the federal level. The federal folks have backed off considerably from where they started. But the state and the county, you may know that we recently had an election in Whatcom County, and there were kind of 4 people pretty much pro-coal and 4 that weren't. And the people spoke, and no one was pro-coal got elected. Not one. And that's a pretty big change of fortune. And honestly, in BC, I think it may come down to that kind of citizen activism. It may come down to if politicians aren't willing to do what's reasonable and just, they are likely to be replaced. At least that's been our experience in my community.
Don't hold your breath on that.
Carol?
Thank
Just for
you
the
very
committee,
much.
please.
Dr. James, you've really done a good job of showing us the dangers of coal contamination on human health. And I'm sure that's true in the environment in a general way, not just human health. We can talk about the birds, we can talk about the vegetation. Thank you. So I guess what I'm wondering is the levels of contamination. Of course, this is a dangerous substance. You've illustrated that. And so one wonders exactly what the levels of contamination are and where triggers exist on those levels to the various impacts, health impacts that you've described. So at one point you did say that there were standards of safety and that you have identified and your colleagues that health outcomes are resulting even if those standards are in place. So are there statistics showing us the levels of contamination at these various points geographically or in the, and how that would relate to the health outcome?
This is an excellent point, and really the only way you can answer that question is by taking this data and applying it to a particular population of people. You got to see who's upwind, who's downwind. Yeah, what they've done in other places, in Spokane, they actually looked at the rail switching yard there, and they looked at cancer rates, and they looked at what age people were there, what gender people were there. They mapped that out, and then they mapped out where the contamination went. And what they found out was about a 20% increase in cancer rate. And what they found out was the closer you lived, it fell off exactly like that because you got away on both sides. And so only by applying it to a particular population, you're going to know that answer. How many kids are there, how many elders, how many people with lung disease, how many heart disease, and then apply how much of the coal dust and diesel particulate matter and noise is going to impact those populations. And then you can calculate it. There are methods for doing it. You can go and you can make that calculation. So then you can know how many cases of asthma in children there would be. You can know how many heart attacks or strokes you would anticipate. But that's why health impact assessment is so important and why it's just incredibly disappointing that the court and registry docs don't want to know that. And they actively don't want to know. And you can only surmise there's a reason for that. So in terms of how many people actually mean, we don't know. You have to do that health impact assessment to know. And I believe that it's essential that that be done before it moves forward.
Wayne?
There's varying grades of coal, and so does that affect the amount of toxins?
That's exactly right. There's basically, I hate to say this, being an American, there's Canadian coal and there's American coal. And it's a little more complicated than that, but basically the coal you guys have here is much harder and much less likely to become dusty and much less likely to be problematic than the U.S. coal. It's much softer, it falls apart easier, it rubs against each other. They have one of the positive reasons for them not covering the coal system is because as they fall apart, they rub against each other and they actually burst into flame. That's one of the reasons they spraying the water on these big piles, which is entirely uncontained. They would use 1 billion gallons of water on the coal dust and coal to prevent dust, but it also produces fires. So it's a much lower grade of coal, both in terms of its BTU capacity, but also in terms of the potential to cause environmental problems. So U.S. coal is different than Canadian coal by and large. It's an excellent point.
Questions? Right?
I guess one issue that I have is, apart from the fact that it's getting burnt in China, why are the coal cars not contained entirely? Why do they have to go?
There's actually a couple of issues there. There is the possibility of an increase in spontaneous combustion problem. But I think the real issue is financial. They don't want to spend the money to change their technology for emptying the car and for filling. If you put a lid device on it, they can't fill it in the way they're filling it, and they can't empty it in the way they're emptying it. They basically run it in and roll it over like this to empty it out. And it would be a financial consideration. The financial considerations are fascinating. I'm not an economist, but they get this stuff as single bidder. This coal is not owned by the companies. It's U.S. government-owned coal. And they buy it for about $12 a ton, $11, $12 a ton. And they get about $130 a ton for it in China. You know, any of you that farm, a good topsoil is worth a lot more than $12 a ton. And we're shipping this stuff halfway around the world. It doesn't really make sense when you think about it. What's going on? So the considerations, I think, are primarily financial. There may be other considerations. And it's not just that it blows out the top. We all know that it rains a lot here. There's also holes in the bottom, so this coal dust is washed through and ends up on the track, and then when it dries out, it blows around yet again. And there's the two main places that lose coal dust is in the point of origin, but also when they ship it back. Once they empty it out, not everything comes out. And so one of the second highest area of contamination would be where it starts its trip home from. That will be the second largest place where coal dust will be considered.
Wayne?
What do you use to spray from the
It's a surfactant. My understanding is a variety of kinds. And it's somewhat proprietary, but it's like hairspray. You know, it basically sticks the top layer together. And my understanding is it's got magnesium in it primarily, but other things. There is some serious consideration about the safety of it. I mean, I don't think the safety has actually been studied. And parenthetically, they're planning on using this on barges. And that's never been done, or has it been studied. And no one really knows what the potential impacts might be. So it's an interesting question, what it is and what impacts will there be from that ending up in the environment. I think it's a very serious question that hasn't even been asked, to my knowledge. I've heard that the environmental impact assessment that they've done, this kind of brief from the other one, will be released potentially Monday. And we'll find out if they thought about that and have a crisp answer. To my knowledge, look at the literature and talking to people I know, nobody knows. You would hope that they would have thought about that and have systematic answers. Look at it. Because otherwise, they're just going to spray it on barges and run it from here to Texas Island without understanding what potential consequences might be. And those unintended consequences, you know, last year, there's a potato shellfish is one of the largest in the U.S., and they have farms near where I live. And they couldn't grow oysters because the ocean acidification had increased to where the young oysters couldn't survive. They had to start them outside of the ocean. And as you all know, we don't really know why all the starfish from BC to California are dying, but 90% of them are dying. And I go out on the water every day. I live by the bay, and I go out every day. And I got to it breaks my heart to see a place where there used to be hundreds of starfish with none. It scares me very, very. It scares me for me. It scares me for the environment. It scares me for my children. So I wish I knew. It's somewhat proprietary. I don't think anybody knows. Perhaps they do. If they do, they had to share it.
Harry?
From an environmental air quality point of view, should we just be paying attention to the PM2.5?
But there's the PM10, the PM2.5, and the PM1.0. So there are different sizes that do different things. What we know is less than 2.5 is the stuff that gets basically into your bloodstream. Right. So that's the one that I think is the most concerning. However, there's recent data about this even smaller stuff, which is even more worse. But yes, I think that's it. The coal dust is largely larger than that, and the concern about that, I think, is really the mineral content of it, the metal content of it, and where that goes in the environment and how it then comes back through the environment to us. I think. Oh, excuse me. What was it?
Well, the rest, what should be concerned about is obviously not airborne
Right.
It's the metal
But
contamination.
the coal is relatively inert until it gets in the environment, and then once it's organically metabolized or changed, it then has a life of its own. One of the concerns, though, just to I actually have some slides further on, and I don't talk about the environment much, but just south of the West Shore in the United States, I have the data actually for the herring population there. And the herring each decade have gotten fewer and fewer and fewer and fewer. And I think that has nothing to do with the chemicals. It's actually the fact that when this stuff blows off, it ends up on the eelgrass and simply is so solid that it blocks the sun from being on eelgrass and can cause the eelgrass to die. Well, the eelgrass is where the herring lay their eggs. If you don't have eelgrass, you don't have herring. And if you don't have herring, you don't have salmon, and you don't have salmon, you don't have porpoise. And there's some very unpleasant scenarios that I hope very diligently somebody thinks through very carefully before they let this go forward. And we have data about the herring here's the largest ferry in Washington State. That's how big the ships are that can run in here. They're single hulled. They have the worst safety record of any ship. They're the largest thing human beings have ever made to move. And that's what they want to run up and down in the Salish Sea. With huge impacts on sound and on marine mammals. But that's the West Shore, and it's very safe, they'll pay that, but they don't like to talk about this picture. This is another one that just went around recently and broke up in half. There are lots of them. This is the West Shore Terminal on a windy day. Probably seen it yourself. That's the coal dust up at Prince Rupert. There's a fellow that's an inspector there. And I wish I gave the first talk I gave there, he gave a series of the slides. And I gotta say I was shocked. He's still working as an inspector. He came and he showed these slides. You got some great people. That's coal dust on the surface of the water, Prince Rupert. Underwater noise is a big deal. But let me just skip through this to, here's, in the 70s, this is how many herring there were. That's Port Roberts up there, and this is the coast down to Tuolumne Island where I live. This is the next decade. You can see there's less. Here's the next decade. It's all gone from Point Roberts. And this is the most current data we have. And that's where we're going to put the coal. So there are things that I think, we just need to have answers before this goes forward, I think, both in terms of human health. And there are many, many environmental issues I haven't even said anything about. But they're concerning. I guess I'd leave you with one story. It's the one that has come back to me the most. There's a reporter interviewing a radio person. We've done a long interview and this 3-day series on the radio, and then they interviewed her about doing that series, and she played the tape of talking to me, and it's the one I've gotten the most comments about, and the one that I think affects me the most deeply. She was interviewing me about where we live, because we live about 3/4 of a mile from the train tracks. And I've been reading The Hobbit to my son, the whole series of 4 books, and we've been about 2 years reading this series. And we were the last few pages of the last book. And it's a very heartwarming story. It's a lot of struggle, and the little wee people that aren't very powerful end up saving the day. And we heard a train coming, and you can hear coal trains a long ways away because they're so heavy, they squeak and they squeal. And so my son, who's 9, looks up at me and he says, "Dad, is that train from Mordor?" Now, I used to laugh, but I can't laugh anymore. Because it is. Thank you for your time.
Yeah, just for questions, Councilor Macus would like to ask a couple questions.
I wanted to.
You're going to be brief, though.
Yeah, thank you very much. And thank you also for being up to date in terms of what Delta has been doing. And I just actually wanted to touch on that a little bit because you've obviously read. So we did do some coal dust monitoring through our environmental team. And we do have some results. And so all 4 Dustball Monitoring locations in Tawasin had relatively low overall total dustball average. The average total of 10 milligrams collected in the canister over the 32-day period. This is DO1 in our package, and it's 3 of 5. And so you've read that. So the results are here. So that's in 32 days, and so that's coal dust. And I mean, you showed a picture when the wind was up, but this, I guess maybe there wasn't as much wind during this particular time, which maybe is another thing we should be doing it more.
There's
over the
actually a
course of the
standard
year.
for that. The standard in the US is you collect data for 3 years to get an accurate number. So
So
1 month is a
county
good thing, but the standard in the US is for 3 years.
For 3 years.
And something that you should know is that Burlington, Northern Santa Fe have been collecting that data for 10 years. They haven't, and they're not sharing it.
So, and
So
have
they've already done it.
So that, and I wanted to move then to where there were 4 sites in Tawasin, which is quite a ways away from West
Yeah.
Shore. And then the site that was quite close to the rail line, 15 meters, actually was 30 times more particulate matter than the Tawasin samples. And so when it's, when we've got this weight of dust, 300.1, how do we read that? We've sent this off to the medical health, chief medical health officer to get some assessment. Because this is really what we're talking about is in areas where there's, and I think Carol was aiming for this, like, how do we know when you've got too much coal dust? I mean, that's really the issue. And, I mean, just for background, this coal port exports about 33 cubic tons, metric tons per year.
Yeah.
And we're talking about Fraser Surrey Docks, 4 million to start with, and then up to 8 million, but that would require, I understand, a separate environmental assessment and permitting process. So the 33 million coming through our community already, like we've already got a major coal port here in Delta. We're already dealing with this. And to be honest, I thank you for your, the suggestion for assessing the rail, you were mentioning the Spokane rail switching yard and the impacts there. I don't think we've ever heard what the impacts are for the folk working at West Shore. We've never tested for that. All we can do is we can test for our residents. We know that in Tawasin, over a 32-day period, the results are low. If you go close to the rail line, it looks like it's very high. Now, if it's that high there, it would seem to me if there were residents, like houses that close, obviously, we've got a problem.
So a couple comments. One is that, a month isn't long enough. I mean, I think we need longer-term data to really have because it depends on the precipitation, it depends on the wind, there are a bunch of factors that go into it. So you have a sample. The sampling period needs to be longer to have representative data. So you really know, and it may be better, it may be worse, but it also may be further away. So what you have is some 30 times the standard, 30 times what's considered safe is in this one test. And so on a really windy day, you might get a lot more further away. I would suggest, what we suggested was that there would be gradations of testing, not 4 kilometers away right by it, but actually gradations, near, 50 meters, 100 meters, 500 meters.
And just to be clear, this isn't the rail route that the BX.
Yeah.
This is Canadian coal.
This is existing.
And it's Canadian coal as well.
So it may be a best case scenario in some ways. So I think you need to look at a finer gradation near the track, and you need to look over a larger period of time to know. But even then, that just gets you started. Then you actually have to begin to look at what the impacts may be. There are 2 different kinds of impact. There's the immediate health impacts on the people that would live, work, or go to school in that setting. There are also the environmental impacts of what happens when it gets into water, or into plants, or into the animals that live there, that then come back into the human system through as food or through water sources. So it's a more complex analysis. But I think that's what you have to do to really begin to have an idea of what those impacts actually are.
So the terms of reference for the environmental impact assessment processes proceeding for, I guess, is it for Cherry Point?
Yeah.
Are those available publicly? I mean, and
Not until they fund.
what about the ones that the folks are doing themselves? Do you have a draft terms of reference
Some of those, yeah. Because, so it's about a $500,000 project to do it right. And we have about, just to be blunt about it, we have about $180,000 we put together, because this was everybody pulling out their wallet and saying, How much are you gonna put up? And so we don't plan on doing everything. We're gonna wait until we know what they're gonna do, and then we're gonna fill in what we perceive to be the empty spots. So we haven't scoped ours either, because we're gonna wait until we find out what their scoping is.
Well, gathering data is expensive, and that's probably why
Very
we only did it 32 days.
Yeah, oh, yeah, absolutely.
You know, so it is,
And the analyses are expensive too, both the gathering and the analyses can both be quite expensive. Again, a proper health impact assessment, at least for our site, we estimate to be about at least $250,000 and probably about $500,000 to both collect the data and then to analyze it. And then you have to then take that and you have to look at what the distribution of the population is and what the distribution of those contaminants would be within that population before you even get to the beginning of knowing what you're talking about. That's why it was so profoundly disappointing to have the court say they want to do this in 2 weeks and that's okay. And that's just nonsense, frankly.
Have there been any major studies done in Australia?
But it's the other thing I was going to
Because
mention.
they've got some ports down there that make us
Yeah,
look like.
and what they know is that cancer rates in the people who live there are significantly higher.
Okay.
So there are several studies in port cities, and what we find is that cancer rates are significantly higher. There's also some studies done. When this first happened, I'm a jurisdictional health officer, so I did the logical thing. I called the health officer on the East Coast, where the current largest export facility is there. And it's interesting because he said, you know, Frank, we got twice as high an asthma rate in our kids as other jurisdictions, and we don't know why. He said, we looked at the coal dust, it doesn't seem to be the coal dust. He hadn't thought about diesel particulate matter, which is almost certainly what's causing it. So I think looking at other sites is a very good idea. Looking at the ones in the States is helpful, and looking at the ones in Australia is helpful. That's been done, and actually in the summaries of information we have, I can send to you the questions and concerns we have
I'd like
that have all those footnotes.
I guess that would be helpful, because
Yeah.
I guess to the extent possible, it'd be great to share best practices and information, because
Absolutely.
why redo scientific
If I
research.
get an email address, it'll be there as soon as I get it to a connection. And we have a summary document that summarizes the data and it has all the footnotes to go with it. And if you go to coaltrainfacts.org, we put it all online. I would love that I was wrong. And because we're totally transparent, we put it online. We put all the articles and all the summaries online, so anybody who wants to look at it can look at it. And I would love for the Coal Alliance or Registry Docs to look at that and tell us we're wrong. But I can send you a summary too, that it's got it organized and communicated. And also, I recently collected the questions that I believe need to be answered before you go forward. And I can send those to you too. They've got a whole series of very specific questions that I believe would need to be answered before I would be comfortable with just going forward.
And then on the diesel particulate monitoring, what best practices do you know on that front?
There's a lot of data about that, because it's not just the railroads. It's estimated that in Seattle area, the current health burden costs for the prior to doing this, these particulate problems, is about $190 million a year in healthcare costs. So it's probably similar in the lower main, probably a little more here. And so there's some pretty good data about that already. And again, I can send you the references for that. I'd be happy.
Is the comparison between trains and trucks straight across? Like, I know that in diesel vehicles since 1997, trucks have been cleaned up 90 times or something like
For
that.
the past
But
2
railways, I'm not sure.
For the past 2 years, every truck and every diesel truck and diesel car manufactured in the United States has been required to have 0 diesel particulate.
Mhm.
None for 2 years. The railroads negotiated an exemption.
That's the question I guess you should ask.
And there's a schedule for bringing them online, but it extends out 3 years. Yeah, so you can do it. You've got these catalytic converter-like things that can remove all the diesel particulate if somebody wanted to do that.
And we know that our port only accepts trucks that have been,
Yeah.
kind of converters on.
But
so-
ask them about the ships, ask them about the boats, they're the things that the little tugboats that all the ask them about those, because they are not.
Carol, really quick, and then we're going to move on.
Okay, so in our study here, it talks about the BC air quality guideline. At the bottom of page 3 and 5. So, and of course, the guideline there is 1.7 milligrams per day, per day, and this falls way below in terms of what was measured in that 1 month in Tawasin. So I guess my question is, what are your guidelines, or what is the U.S. or the Washington State guidelines? And are you sort of telling us that all coal transportation is bad and not really talking to us about levels?
Two things. I think it should be the best available science, not what the standard currently is. Those are politically set. Those are not scientifically set. So I would argue for the best available science rather than what these political things are. That's a political
So
determination.
what is yours? What is your best science guideline?
I'm embarrassed to say that just, there are 3 countries in the world that don't use the metric system. Burma, Libya, and the U.S.
So this is a different language.
You agreed to do that once and then reneged.
But
The
I'll
scientific community certainly uses that, right? In the U.S.
Yeah. So I actually don't know, but again, that's easy to find out. I can get it to you when I see the other things.
Yeah, well, I guess again, this is the most important question for me at least, because, obviously, coal dust is harmful for the environment, harmful for humans. And when I asked the question earlier, you said that it depended on a particular place and to see what kind of effect it had there. But of course, that doesn't make all kinds of scientific sense, because, hopefully science would have some guidelines and would say, at this level, we've observed these kinds of outcomes, and at this higher level, these greater outcomes.
Well,
and lower
that
levels
information is known.
outcomes.
That information is known.
Okay.
What's not known is how it applies to this population. Because depending on which way the dominant winds blow, depending on how much rain there
Yeah,
is.
but then you
There's
get-
nobody living in the North 40.
Yeah,
It's-
Where this monitoring took place.
Yeah, it's still pretty foggy, the levels and what you're saying when you get to specifics. This is what makes me a little bit. So, yes, we could get what you consider, say, scientific guidelines compared to what.
And it would depend on whether you're talking about kids or elderly,
Okay,
people
well,
with
then,
pre-existing
yeah,
lung
yeah.
condition. There's a bunch of,
Yeah.
what's safe for a young, healthy person
Yeah,
might
but
be
just
different.
so we
from
can
a-
compare it.
Yeah,
Thank you
I
very
totally
much.
agree.
Yeah, thank you.
Just finally, in terms then of mitigation of coal dust, one of the things that Delta has asked for from West Shore and BNSF is to have an additional spraying of the cars when they come across the border. And after seeing the results of the study, I understand that West Shore was going to go back and talk to the company, check their video monitoring, find out which cars could be problematic, go back to the companies and request additional mitigation. So for a starting point, what is within our purview that we can request and work with the companies on is mitigation.
Right, and you guys are actually, I was shocked to find out that the coal that travels in Canada, it travels a much shorter distance and is sprayed twice already and is not allowed to be heaped up above the top of the car. The Canadian coal isn't allowed, they don't allow that here. And the US stuff is heaped up above it and it's applied 1,000 miles away. Not surprising that it might come off on the way. So there are very different standards in Canada and the US. So you're getting stuff from the US that's being treated like we do in the US, very laxly. You have, for the coal here, a much higher standard. So a second spraying of surfactant near or at the border would be, it's a very reasonable thing to ask for. And
We've
we
also
know-
brought up to them that in Europe, they apply some type of white latex to that material, so that if you do have cameras monitoring, it's very easy to see if there's areas that are broken free or whatever, and what the coverage is. And they've told us that they're prepared to look at this. This is West Shore I'm talking about.
Right, right.
Sorry, Delta Docs. But they're prepared to do that, or at least look at it.
Yeah. That's very, those are, at some point, there is a place where how do you mitigate, how do you, depending on what the issues are. Yeah. And those are very sensible, I think, ideas.
Well, thank you. We did pass a resolution and asked council and the mayor, under the council's endorsement, sent a letter saying that we were opposed to coal being transported through Delta, that's all we get is on the Surrey Delta docks as it comes through. But it runs right along the North Delta escarpment, and I just happen to live up on the top of that. So it is kind of interesting to me. Well, the committee will decide whether we don't want to make another recommendation. I'd be quite surprised if we don't. But we are getting on tonight, so I'd like to thank you very much.
I would urge you to carefully consider what you ask for, and that a health impact assessment, an objective, independent health impact assessment, is I think the only way you're going to get the kinds of answers that you want.
I'll be very surprised if that doesn't come out of the committee.
Thank you very much.
Thank you very much.
Thank you.